I got to be honest here. Physicians make a lot less money in other parts of the world. We make a lot less money. Now, with that being said, we also pay less for education, right? They're not paying for college. They're not paying for medical school,
right?
All that stuff is rolled into so, and there's different ways that they get into medical school there. Like in some countries, you just take a test, and if you get a certain score, you can be a doctor. If you don't get that score, you can't be. So it's a little bit different. Like in America, if you're working hard and whatever, you can kind of get there as long as you're persistent to a certain extent. So I recognize the differences in the countries in terms of that, but at the same time, the way that they operate their healthcare system allows all of these individuals in their country to be covered. In America, the reform is going to have to include probably me taking less. I mean, we make 4 times as much as they make in England.
But to your point on that as well, doctors are making less now than they were even back in the 80s when you actually look at it.
Mm-hmm.
So you might make more money compared to other countries, and you made a good point there. But if we're looking at the United States, you guys are making less money than you were previously. So do you cut it back more? I mean, you guys are working harder. We just got done saying you're seeing 30 to 40 patients, mm-hmm. and you're working on all of this off time. You don't know what the answer is there.
Yeah, I don't know what the answer is exactly either. But if I'm being fair, and I consider myself fair,
yeah,
and if I'm going to compare myself to other countries, I have to look at what they're doing. I can't just say, all right, I'm going to do everything but X, right? Because that's essentially what the AMA did throughout the history of health insurance, is they basically opposed any national healthcare system because they were worried about physicians and reimbursement, which I understand. Mm-hmm. But I do think that we also have to look at pharmaceutical companies. We have to look at not just pharmaceutical companies, but insurance companies and something called pharmacy benefit managers, because there are all these companies that are associated with healthcare that are now taking a significant profit.
Yeah.
Right? So they take this significant profit of money, and that money is away from the healthcare system and going into somebody's pocket. Right?
There's a lot of levels to this.
Yeah.
And we could dive into a level per pod and be here for a year. There's a lot.
When I look at other countries, I mean, the other main thing I see over there is that the companies that are providing the care are not making a profit. They're not making a profit.
Right.
Again, I'm not saying that the insurance companies, the pharmacy benefit managers, everybody that's providing care should make a profit. I'm not saying that we should make a profit. I'm just saying that when you have an insurance company that makes $100 billion.
It's just been manipulated at this point.
Right. And they deny 40% of the claims. Come on. That's a little ridiculous. So I don't know if you can put a cap on profit. I don't know if you can put a cap on what's being denied. I don't know if you have a government team of clinicians who are actually responsible for saying whether or not a certain claim can be denied or not, right?
Right.
I don't know what you do, but I do think that it takes discussion.
That's the point here. We need to start discussing. We need to open up the conversation more. It's not about this murder and Luigi and what he did. That's wrong.
Right.
But the conversation now needs to turn toward, what can we do? We're all in this together. We all feel the same way, or at least most of us do, whether it's a patient or a provider. How do we make progress? There has to be progress.